Dr. Key, thanks so much for joining us today.
Thank you for having me, Don. It's a pleasure being here.
So tell us, first of all, what's the purpose of this study?
So, the purpose of this study is really to one, bring awareness to the lack of utilization of family health history, specifically in the African American community, and then to also create a culturally appropriate toolkit for African Americans so that they can begin to collect family history so that when it is time to go to the doctor and to share that critical information, that they are armed with that information.
And not having this information, does it impact the type of health care you receive?
It doesn't necessarily impact the type of healthcare, but you want to make sure that you're getting the specific healthcare that you need. So when the doctors, all of us have gone into the doctor's office and we have to fill out that clipboard, right? And we're asking all of these questions, they're asking all of these questions about what runs in your family. When you don't know what runs in your family, you don't have the right information. And that could indicate to the doctor what type of preventative screenings and what type of regimens to put you on. But when they don't have the proper information, you might be at a greater risk of, diabetes or hypertension or stroke if those things actually run in your family.
So you're actively looking for participants to participate in this study, and it is a paid recruitment, correct?
Yes.
So tell us about the recruitment effort and who you're looking for.
So first of all, when we think about family health histories, it impacts everybody outside of all races. But what we know from the data is that African Americans are most disproportionately impacted because they are the group that underutilizes family health histories. So for this particular study, we're looking for African Americans 18 and older who live in Flint, Genesee County.
And how much are you paying for the participation in the study, and what do participants need to do?
So participants first need to contact my research assistant. Her name is Corinne Blanchard, and her number is 810-600-5677. Once you contact Corinne, she will go through a screening process with you. And if you are eligible, then you are also eligible to receive the honorariums or the stipends for participating. And for that, it's a total of $120 gift card worth of gift cards. But there are 2 sessions that you go to in the initial beginning of the study. And this is all educational. So no, we're not extracting blood or any bio fluids from the body. It's all around education. So no one has to worry about blood draws or any of that. It's really about educating around family health histories, giving participants a tool so that they can utilize family health histories in their up and coming doctor appointments. And then we have a 3-month and a 6-month follow-up. So it's important that you also go to the doctor if you're going to be a part of this study.
Yeah, and does it require, when you say education, it requires you talking to family members, or you provide a tool to help start those conversations?
Absolutely. So Don, this is phase 4 of this study. In phase 1 of this study, we did focus groups to find out what were residents' understandings of family health histories and did they utilize them. And then in phase 2, based on that data from the focus groups, we created workshops about what was missing, what people didn't understand about family health histories. And then in that workshop, we showed them some kind of general family health history tools that are out there. But we then asked the participants to kind of customize it specifically for African Americans, looking at the culture, looking at the language. We know health literacy is an issue, looking at all of those things. And part of that is actually in creating scripts so that they could actually have these conversations with their family members.
Dr. Kent Key, and no better time to have those conversations than now around the holidays. But Dr. Kent Key, thank you so much for joining us today here on First at 4.
Thank you.
And if you are interested in joining the African American Family Health History Study, you can call 810-600-5663.